Good afternoon, everyone. Thank you for joining us for a very exciting next session titled Decoding the National Health Stack. I'm very pleased to announce that we have with us past CEO of Ayushman Bharat, Dr. Indu Bhushan. He's a former Indian bureaucrat and economist who brings his expertise in public policy, health sector, and a multicultural experience from an international development agency as well, with strong combination of academic qualifications and professional experiences, and a very strong track record of delivering innovative and complex projects. We welcome you, sir, Dr. Indu Bhushan.
Thank you. Mm.
We also have with us Mr. Arun Seth, mentor and advisor to startups, board member at Narayana Health. He's currently an independent director on the board of Narayana Health, also an active advisor to Avendus Capital, Nutanix USA, United Technologies, and InMobi, which he incubated in 2007. Welcome, sir.
Thank you.
And last but not the least, the chair of this session, Saloni Malhotra, VP at Paytm Health, a 0 to 1 champion. Saloni builds businesses within Paytm and hands them over when they take off. Welcome, Saloni. And a big shout out to Kalari Capital, Ivy Cap Ventures, Deloitte, and Dell for their continued support for this session. Over to you, Saloni.
You might be mute, Saloni.
Hi, can you hear me now?
Yes.
Yeah.
Brilliant. Thank you so much. Really happy to have Mr. Seth and Dr. Bhushan here today with us. We're here to talk about decoding the national health stack, and I'm going to request Mr. Seth to set the stage and give us a quick introduction.
Thank you, Saloni. I must make a claim that being the oldest on this panel, and I'm quite proud to say that, I am most likely, if not already, the largest spender on healthcare amongst the people on this panel. So who else is better qualified than me? I call myself Mr. Revenue for the industry. That's the name that I've used. And that's the reason I have a right to say something to this industry. But the real issue today is that for too long, patients have been at the mercy of the gods. And they are truly gods, the doctors, when we are in deep trouble. And even more, the administrators of these hospitals who have to ensure a return on the investment. That too in a field that faces obsolescence on equipments each new year because there's new tech coming out that's faster, cheaper, and better. And regulations becoming tougher and tougher. I can say this industry is one of the least patient-centric in relative terms to finance, retail, and any other sector that you can think of. I don't blame them, as they need to give better outcomes for real people and keep us alive rather than just satisfying the cravings of food or clothes or banking. So health tech, my friends, or med tech, whatever you call it, is the revolution we need to give power to the patients to manage the health outcomes at lower costs and, most importantly, better outcomes. So that's what comes in. The national health stack, which Dr. Bhushan, he'll talk more about it. He is one of the people who brought it to life, is the path to do it at scale. Very much like UPI had changed the landscape of fintech and lowered the fees that was being charged by legacy providers by being the hoarders of information. Transaction fees, in the bad old past used to be 2.5%. They're now down to 20 basis points. And I'm saying there are a lot of people who are in pain because of that, but that's right. The customers are benefiting. And the transfers took days. Now they take milliseconds. It's even brought the goodness of financial inclusion to the masses. So in the national health stack, which is the topic of today's discussion, we have a similar revolution brewing, which will democratize the health records of us patients, give us the power to determine our own outcomes at far lower cost. I hope you're aware that in the US, they spend 20% of GDP on health. In India, it's a measly 2-3%. But innovations like the health stack will be able to give better outcomes than the US for even, say, 5% of the GDP. So I think it's a bold assertion that I'm making. And the challenge to you entrepreneurs out there is to listen carefully to the words of today and go forth and disrupt, as you said. That's the good news for patients, but the challenge is its adoption, creation, and which is where startups like you excel, who are not bound by tradition, by the high energy of challenging the status quo, fueled by investors who want to create a brave new world. So good luck for that. I've seen it in my field of telecoms. We started 25, 30 years ago with 16 rupees a minute for incoming and outgoing. And now it's a very small fraction of that industry. And the good part, again, the only good part of COVID, I would say, is that behavior has changed to remote. Nobody now wants to go to a hospital. They want to do stuff at home. And this health stack is going to really be the power, the underlying infrastructure, and I'm sure Dr. Bhushan will tell you more about it, to help us meet this new, grand new place. So over to you, Saloni, to take this ahead with Dr. Bhushan. Okay.
Thank you, Mr. Say. Thank you, Mr. Revenue, I would say. And from Mr. Revenue, we are going to now move to Mr. Policymaker. Um, and I think it very beautifully, put two things in place. We had the telecom revolution, we had UPI, which was a payment stack, which really changed the way we all looked at payments. And now, Dr. Bhushan, if you could tell us what really is this national health stack and why is it important?
Thank you, Saloni, and thank you very much for having me here. You are absolutely right that there is a revolution going on, and Arun took some words out of my mouth that whatever UPI has done for financial sector, same thing potentially can be done by national health stack for the health sector, where not only it will bring down prices, it will make it more transparent and more effective, but at the same time, it will provide a huge amount of innovation space and opportunities for startups and industry. Because the kind of innovations that have come about in fintech probably was not even, we couldn't even think about those about 10 years ago. So, coming to your question, Saloni, that what is the national health stack? The government has been working on this concept for last 5 6 years, and there was a committee set up under Narayana, who used to be IT secretary, and they created a national health blueprint, national digital health blueprint, which has become the basis for this mission. And in this, the idea is to use digital technology for improving quality in healthcare. So basically, it has four major components. One is registries, so that every individual, all doctors, all healthcare professionals, all hospitals, all pharmacies, and labs, all everyone in the healthcare space has a unique ID, and they are registered in the registry so that there is one source of truth, and they can be verified using that registry, and that will be a public good which will be maintained by the government. So that's one component of national health stack. Every individual, every doctor, hospital, every drug, every pharmacy will be given one unique identifier. Number two thing is that the concept that federated architecture, that data which is generated in health will remain where it is, closest to where it is produced. Third is setting standards so that everyone can talk to each other. What we've learned from US, Arun mentioned about the healthcare in US, they data is in silos all over. So, to ensure that there is interoperability, this mission is going to be defining standards for how personal health records should be created and shared, how lab reports should be created and shared. So, those standards will be created. And finally, there's a health information exchange system which is being proposed, that will have a consent manager, so that any data which is shared through should be through consent. In the design of this, there will be privacy and security by design, so that all this data is in the hands of people who own the data, that is the patient, and so that will be another part of it. So all this structure, once this is created, so that will create the backbone for this national health stack. On top of that, all the applications could run, because this will be providing open information through APIs, and it will be all interoperable. And so this entire stack could be used for any issue, whether it's a, say, e-claim platform for insurance companies, or exchange of information, or if a patient goes to the doctor or a healthcare professional, they can see the entire record, not only past record, but all the records that they're there in the system right from the birth. And similarly, if a patient wants to see which are the doctors or particular specialties available close to the person, they can see, and they can see which of them are certified, which of them um, have what kind of ratings they've got from other doctors. So there are a huge number of use cases once this is in place. It's only beginning because it was launched on a pilot basis about 2 years ago while I was there in 2020 August on a pilot basis in 6 UTs, and it was expanded about 9 months ago to the whole country, and we are going to be seeing results coming out of it very soon.
Very interesting. It almost sounds magical, to be honest.
Mhm. Yep.
Um, and this kind of change will obviously take its own time. But I have two
Mhm.
questions. You mentioned that every entity will have their own identity. But as citizens, we already have a very strong identity in Aadhaar. So why do we need to create a new, Aadhaar number, as they call it? Why do we need to
Mhm.
create a new number or a new ID?
Mm. Uh, Partly it's a legal issue, Saloni, because the Supreme Court has very clearly said that you can't use Aadhaar for anything else apart from those things where you have the consent of the person. And because the Aadhaar is also linked to many other information of individual. And so if you use Aadhaar, there is a possibility that while we are interested only in health, we could also see their bank accounts and other things. So I think it's largely because I mentioned that national health stack is based on security and privacy by design. Therefore, we did not want to compromise with the privacy of individuals by taking Aadhaar, and legally, it's also not allowed. So right now, when you create Aadhaar, uh, they'll ask you for your Aadhaar, but if you don't want to give Aadhaar and you don't want to give consent for Aadhaar, there is a provision you can give many other set of identifiers where you can use that. But the idea is that the health ID or Aadhaar should be unique. People should not get two or three Aadhaars made, because otherwise it will defeat the purpose. Because the idea is that if you have just one ID and you've been to a lab for getting some tests done, you've got some vaccination done, later on you have some treatment done, you bought some medicines, all of those could be linked. And if unless those are linked and one can see the whole longitudinal record, it doesn't serve too much of, then probably the purpose is defeated, Saloni.
Sure. Thank you so much for that. And you mentioned that that the data is secure. And
Mhm.
if you could talk a little bit about this, where does the data reside? Because as I go around talking to both citizens as well as to hospitals and labs, I think the uninformed always the first question is that why should I share my health data with on a platform like this? So if you could tell us
So
where.
right now, yeah, right now, if you look at it, and that holds for large number of hospitals, including hospitals like AIMS and PGI, that 90% of the health data is not in digital form. As far as lab reports are concerned, much of that is in digital forms. But you talk about discharge summaries, you talk about patient notes, you talk about outpatient notes. All of them are written in longhand. Prescriptions are mostly written in longhand. So the first challenge for the mission will be how to change this whole structure, how to ensure that all these personal health records are digitized. Until they are digitized, at least we'll be working on PDF files. And so right now, all of that information actually is stored with hospitals, and it's not very secure because it's all in paper form and in files. And with the individuals, they have most of the time copies of their records, and it's a you go to any hospital, it's a usual sight that there will be a person with the thick file of previous record under his or her arms and going around. Some of these papers are very old and not legible. And so with this system, at least all of this information is available through a click of button once consent is given by the person. And coming to a question that why should people share records? So there is a very strong provision in this mission that the record will be shared only after the consent of the patient or person that that record belongs to, and the person can give consent for part of the record. For example, I have say mental health problems in the past or sexual health problem in the past, and I don't want to share that record, so I can just click that, okay, I want to share, I've gone there for treatment for say cardiology, and so all those particular related to those record I can share. And not only that, uh, not only I can share selective records, I can also mention that this record should be shared only for say 24 hours, and after that there is no access to my record. And here it'll actually also break a lot of monopoly that doctors and the hospitals and labs have while they keep record of patients for some time, and many time patient herself or himself does not have those access to records. So when they move to a different hospital, they find it very difficult to get all the records from the previous hospital. In this, the interoperability and transfer of record to other hospitals will also become much easier. So here, I think it's a win-win situation for everyone in the ecosystem. The patient has much better access to record. They have much better access to what kind of services are available in more transparent manner. They have ease in terms of getting the appointment done, getting the same medicines if they want to buy and purchase medicines, setting appointment for any lab work or ordering something at home. So all that can be done sitting at home. For hospitals and doctors, again, they have a much better record to deal with, because right now many times they are asking for repeat tests because some of the tests are not available. Now with this, they have much better information base on which they can make the diagnosis and treatment. But at the same time, there'll be huge benefits for other players of the ecosystem. For example, take insurance companies. Right now, much of the information that insurance companies get are through paperwork. Now, if you just imagine if this whole system is in place, an insurance company first have to say pre-authorize the treatment. So they can see whether the person through the health ID is insured or not, and they can see what kind of treatment the person has taken. For example, if person has already done 2 cataract operations and the person is coming with third cataract, they can and they'll know that this is not the right treatment. So they can do it without exchange of any paper. And after the whole treatment is done, then again there are no papers required, and the hospitals can submit all the papers and the claim electronically, and the payment can be done through UPI also without any paperwork. So it'll this is what they call unified health interface, and UPI will also interact in that way in terms of providing. So I just gave you one example of how, say, health insurance companies will benefit, but similarly, other people in the ecosystem will also benefit. For example, hospitals. When they establish hospitals, they have to take on an average about 47 or actually 54 different approvals. Now, with the system, there could be that the kind of information which is given to all these 54 regulators could be given on the same platform. They can provide comments on the same platform, and the approval can be easier. And in many cases, every 2 or 3 years, they have to renew those approvals. That can also be done using the same platform. So I think everyone in the system is going to benefit. But biggest beneficiary will be the patient and the improvement in the healthcare because of the improved transparency, improved effectiveness, and cost savings.
Incredible. I think it couldn't have come at a more opportune time. a lot of the change management that was required, probably COVID brought in that change of mindset much more quickly,
True.
and I think the stage is set for it. You already answered my next question partly, which is what are the new opportunities that are opening up for young startups? And if there are other ideas, would love to hear that. But Mr. Seth, also if you have some comments on that, would love to hear what are the new opportunities opening up for young startups.
Saloni, there are a huge number of opportunities which are available. And National Health Authority, even at my time, we had created this sandbox, and we were inviting innovators, startups, and industry to come and test out their products using our core building blocks, whether those things work using health ID, health, and different other registries, and also whether there's records are compliant with our standards, and also they link with our consent manager. So now, if you look at several use cases, I gave you one use case which was for health insurance, but there will be a lot of health information providers. For example, all these hospitals which are going to be keeping record. You said where the record will be kept. So they'll need storage capacity for keeping all of those records. Right now, they're being kept in files and papers. Now, once you put that, so I see a huge market for, say, cloud service providers. Then there will be huge market for, say, search engines. People who are based on this information and APIs, a lot of people are going to be interested in finding out, say, which is the which is a good 4-star, 5-star cardiologist close to me, and so having that kind of application will require, of course, some market innovation. Similarly, there will be health information users as opposed to health information providers, and these users will need to have applications which can collect all this different health records from all over the country and indeed the world, and tell them in a systematic fashion, given the whole history of the patient, how it will happen. Similarly, when we see the use of this data for the government and research bodies, there will be need to anonymize this data and also share it in a way with the government and research institutions to, for, of course, public good purpose. And for that also there'll be applications. Telemedicine is another huge use case where there will be a need for this. One thing I wanted to tell you is that this national health stack and national health mission is going to be platform agnostic, because as you know, different hospitals and different labs have their own systems. But this is going to be ensure that irrespective of what kind of platform you're using in a hospital, that can talk to other platforms which are being used by any other lab or hospital. It's very similar to, for example, you're using Gmail, but if you want to send a message to, say, Hotmail, you're not like you can do it very easily. In telecom, if you have Airtel phone and you can call anyone in Geo. So that kind of interoperability and this platform agnostic behavior will also be there in this national health stack.
Can I add a couple of things, Saloni?
Yes, sir, please do.
No. Indu's covered most of all the major use cases like research. If what he's saying will come true, and it will with these entrepreneurs out there, then let's say you're researching a TB drug or a cancer drug, which could take 3 years of trials. If you have this kind of anonymized data available, you can cut it down to maybe 1 year. So you'll get things done much faster and much cheaper. Therefore, the end drugs. But one of the bigger opportunities I see is, I come from the IT BPO world. You come, Saloni, if you remember the BPO,
Yes, of
Desi
course.
Crew. So when my definition of BPO is, if technology were to directly send information to each other, there'll be no BPO. But that's never going to happen, especially when you're transitioning from a paper old world to the new world. So for the
Right.
next 10 years, the opportunity will be there for providers to come in and make it appear seamless, but you got people behind it.
Saloni,
That's a
I
must.
can think of about thousands of use cases, and
Exactly.
but the key thing is that they will be the cases that we can't even think of right now,
Yeah.
and that is the whole, I think, innovation, like the innovative mind, the unstoppable India is all about. That they will find out cases and they'll find out use of this data and national health stack and come up with something that we had not even thought about. And I'm looking forward to that kind of innovation, which lies in that category of unknown right now.
Right.
No, no,
No,
I can give
absolutely.
you an example. I can give you an example from another company I'm involved in. It's a company in the sound payment space. So we assume that everybody has a smartphone, but there are 400 million people in India who don't have feature phone. They'll all get excluded. But the technology that's been built with RBI allows feature phone to actually participate in UPI. So we need to think like that, because you assume everybody, the UPI app assumes everybody has a smartphone, but there are 400 million people in India who don't have a smartphone. So you'll
Hmm.
exclude them. So we need to find ways of making them participate also, even if they don't have a smartphone. So it
Absolutely.
has to be completely, it's not just platform from a technology, Indu. I would say it needs to be from a smartphone to a feature phone with no phone.
Yeah.
All must be able to participate somehow.
Because I think that is the idea. That's why, when we had taken this pilot, so we were doing it in place like Chandigarh, where connectivity is 100%. Most people have phones, but also we are doing it in place like Ladakh, where two-thirds of the UT doesn't have
Exactly.
connectivity, and also the level of literacy is much different in that place. And so we had developed protocols by which, even if you don't have phone and you have access to local community
Yeah.
health center, community centers, CHC, you can go there and have the this ID made. And also people who are not literate, uh, how will they give consent? People who are very elderly and they are not in a
Are you
position.
talking about me, Indu? You're talking about me?
Yeah, but people like you, if you're, or
I'm
people who
completely
are, say, in
digitally
coma,
illiterate.
people who are in coma and are not able to give consent, then
Hmm.
how do we take care of those
Yeah.
people?
Yeah.
How about children? Who is the parents are allowed to give consent till what date and for what conditions? I think all those things were thought through and are part of the policy, because one of the key feature was that it has to be inclusive. We really
Yeah.
can't exclude anyone because they don't have access to IT, or they don't have literacy. So those people should also be part of this revolution.
Incredible. I think, I mean, just listening about the system gives me goosebumps. And
Mm.
at Paytm, we've worked very closely with NHA to, work on some parts of it that we understand. And I can
Mm.
tell you, we're very impressed and very excited ourselves.
Mm.
And our users are very excited. We've seen many coming voluntarily when there is no use case today, coming, creating their ID on Paytm today.
Mm.
So I'm really looking forward to the system, and we have a few more minutes. So, in case there are any questions that the audience has, we could take that up. Um,
It must be in the chat window.
Or we can
mm,
donate this time to the next session, because we are
Exactly.
already
Absolutely. Yeah, we're all running
15
short
minutes
of time.
late.
Yeah,
Yes.
Let's do that.
absolutely. Thank,
I think
yeah,
that's much
thank you
better.
so much. Thank you so much,
Okay. Thank you so
Dr.
much.
Bhushan and Mr. Seth, and
Thank
looking
you.
forward to this thing becoming a reality. Thank you.
Okay.
Bye, Arun. Thank you.